Hi, I'm Michele Bullock, licensed massage therapist from Washington State, and on this playlist on my channel, it's called MBLEx Prep with Michele. I like to go through and talk about the different parts of the massage and bodywork licensing exam, how to get ready for it, and so on and so forth. And today I want to talk about a specific part of the guidelines for professional practice section of the massage and bodywork licensing exam outline as it's presented by the Federation of State Massage Therapy Boards. I want us to talk about sanitation and draping and in the room protocols. A while back, I created this really cool ebook, and I haven't looked back at it because I've been working on some other projects, but I'm going to go ahead and post this on the link tree in the description below on freebies that you can access. At least for right now, it's going to be free. So I made it a while ago. It's kind of in a different style. Let's see, I made it, I think it's been almost a year since I made it. And it goes through that whole section of guidelines for professional practice, from equipment and supplies to hygiene, sanitation, safety practices, draping, how to take care of your body as a therapist, business practices, and healthcare terminology. So all of that's going to be in that little ebook. I just need to add a couple of things to it, and then I'm going to post it. So by the time this video goes up, it'll be there for you to download really easily and find out exactly what you need to know. So that's pretty fun. But also some other free things. This video is being sponsored by my stuff, okay? So I have to do a little bit of housekeeping. In that list of resources that's going to be in the link tree, one link down in the description below is to my link tree that has a list of all the stuff. The first couple of links are going to be to some paid products that I have, that being a 10-test bundle, so you can practice taking the massage and bodywork licensing exam over and over and over again. It's in PDF form. I have over 1,000 questions on that test, all set up in MBLEx style, and the answers are provided as well. And then I have a study guide. That's what I'm looking at right here, is the study guide that I created in PDF form so that you can check off everything that you studied as you go. And I have a mini course about how to apply for and prepare for the MBLEx and what to expect on test day. And I have a muscle mastery class, all the muscles that you need to know for the MBLEx, their origin, insertion, and attachments. And that little course comes with some PDF workbooks. And then I have a medical terminology ebook. And now I'm going to post this guidelines for professional practice. And I also have a client assessment one as well. So what I'm going to do for this video is I'm going to go through the first part of this ebook and talk about what is important for you to know for the MBLEx and what helps with what's going to help you to have a practice. And like the guidelines for professional practice is all about how to be a massage therapist and be professional. Okay, so that's what they want you to know about. First thing is understanding about equipment and supplies. So massage tables and chairs, something that you may be asked on the MBLEx, is about how high the table should be positioned, and it should be around half your own height so that your knuckles will brush the top of it. So that's kind of the best position for it to be, for you to pivot your body weight over the client. Any lower than that would be for your clients that have wider bodies, or for being able to work on somebody at a lower position to be able to do deep tissue work, less stress on your shoulder. And then higher heights are for techniques that require way less pressure. So the more pressure you're using, the lower your table needs to be. Those hydraulic tables that you can just raise and lower are so amazing, and I'm really looking forward to having one of my own someday. But your basic stable massage table will do the job for a regular practice. And then when it comes to massage chairs, oh yeah, most portable tables have a weight capacity between 350 and 400 pounds, so keep that in mind. And yeah, 6 feet tall, typically. Okay, massage chairs are adjustable. They have knee rests, arm rests, chest cushion, face cradle. Make sure that you sanitize if you're working with a massage chair at an event. Make sure that you sanitize that chair in between clients and use some kind of face padding so that their faces aren't directly on that face cradle, because that can be hot and sticky and sweaty. Okay, so other supplies that you might need would be your linens. Make sure that they're washable and that they are washed. Cotton is wonderful because it washes the oils off a lot easier than synthetic fabrics. Synthetic fabrics will just hold on to the oils and then they get really, really smelly. So that's something to keep in mind. So bolsters, we've got half round, full round. I have a couple of different kinds. I have like kind of a half round. This is my half round one, totally covered in vinyl, so it's completely washable. I can sanitize it easily. And I actually built this when I was in massage school, and I still use it, and it's perfect for bolstering ankles when people are lying prone. And then I have my big bolster that I use for my clients under their knees to help them to stabilize their backs when they're laying supine. And then I have these bolsters that I built with some padding, and they're covered in vinyl and washable for clients that have round chests or full breasts, so that they can be a little bit more comfortable. So that's what those are right there. So all kinds of different bolsters you can have to be a little bit more comfortable. Just make sure that they're made with vinyl or they have some kind of vinyl covering so that you can sanitize them in between clients, so that you're not passing fungi, viruses, or bacteria from one client to another. Make sure they're clean between every session. What kinds of sanitizing products should you use? So I think there's a listing of EPA approved sanitizers for healthcare settings, so you can keep that in mind. I use alcohol for mine, but when you're taking the MBLEx, make sure that you lean into the question, what is like the most sanitizing product that you could possibly have. Make sure and lean into that one when you're doing the MBLEx. Oils. What's the difference between a liniment and a massage oil? A liniment has menthol, camphor, or arnica, so it's an oil that's been infused with another kind of medicine. And so, yeah, I've seen liniments with arnica, I've seen them with peppermint, and I've seen them with lavender. So each of those things has a different use. So a liniment with arnica in it, let's say, for example, I use this homeopathic treatment that does have arnica in it, and it is like topricin, so it's homeopathic. So I do use that sometimes on clients that are a little bit more prone to bruising. And then for that, I've had clients that really liked the essential oil experience. So I've used that. I don't use it in my own private practice now, but when I've worked in other settings, I've used it when it was available. And same thing with peppermint for clients that are experiencing pain. Just make sure that the lavender, peppermint, arnica, any other essential oil that's being put into the oil is diluted a lot, because you put straight up peppermint oil on somebody, it's going to burn their skin. Don't do that, okay? So make sure that it's diluted. Let's see. Massage oils are great for sliding strokes, general relaxation. Massage lotions are better for gripping because you get a little bit more tackiness. So that's my preferences, is massage lotions or creams, somewhere in between. The really tacky, grippy, the grippy texture and the slickness of oil. All right, so those are the kinds of products you'll be using. And yeah, make sure you always use a clean container with a pump or squeeze top to dispense so that you don't have cross-contamination from one client to another. You don't want to be doing that. Fresh oils for everybody. All right, let's move on to talking about the treatment room. Should be kept around 75 degrees so that your client that has very little clothing on can be more comfortable. Now I have clients that run hot, so they don't want any heat on the table. They like to have fans running. So be adaptable for your clients with their different needs, but make sure that you're mindful of making sure that your clients are comfortable if they run cold. So there's that as well. That's the environmental part. Keeping the space well ventilated is important to make sure that the air stays clean. It doesn't get too stuffy. It can get kind of smelly. when bodies are being worked on, things can get a little gross smelling. So an air purifier is a really good idea. Having a crack in the window really helps if you have a window. I don't have a window in here, but I have fans and an air purifier, so that helps. Soft indirect lighting, soft music. So making sure, obviously, that your client feels relaxed is really important. Room safety. This is an important consideration that you might be tested on for the MBLEx, is make sure that there are no obstacles around the table for your client to trip on. So I try to be really mindful that there are no cords on the side of the table that they're going to be getting on, especially on the side of the table that they're going to be getting on. The power cord going to the table heater. I'm like looking at my room right now. There's no cord whatsoever between the chair and the hooks on the wall where my client is going to be undressing and where they're going to be getting into the table. You never know whether your client's going to be wandering around on any other side of the table. So, and also for your own safety, if you're tripping and falling, you could put them in danger. You're definitely going to put yourself in danger. So make sure and be very mindful about any obstacles. And you want to always make sure that there's plenty of clearance around the table and around the room so that you're not stepping on anything. When it comes to getting on and off of the table for your elderly clients or clients with mobility issues, be sure to ask for those, if you have any doubt at all for those clients, would you like me to help you get up? And there is a particular way to do it that's demonstrated in our massage therapy books. I'm sure there are plenty of videos on YouTube for nursing or home care aides on how to help a client to sit up appropriately. So here's one. So just in my standard massage therapy textbook, there's an example in the image of how to help a client sit up, a client with mobility issues to sit up. You just have to do it in a way so that you don't strain your own back. So that's super important. There are demonstrations on YouTube about how to do that. So check out those videos if you need to know more. Yeah, just make sure your clients aren't dizzy before they get up. So there's that. So hygiene and sanitation practices, your own personal hygiene versus sanitation are two different things. Your own hygiene has to do with how you present yourself with clean clothing, with your hair upkept, with your nails being the appropriate length, making sure that your breath isn't bad, making sure that your armpits don't stink, stuff like that, right? So body odor, avoid strong perfumes. That's something that you might be tested on. Those are really important aspects of personal hygiene. I'm wearing my jewelry right now because I love, recording day is wonderful because I get to wear my rings, but I don't wear rings when I'm in my massage practice days because they have no business in a massage room. Bacteria, fungus, viruses can get all up under the rings, and also they scratch your clients, so they're not appropriate. And make sure your hands are warm if you can. Sometimes I'm like, I'm so sorry, I cannot warm my hands up. Sometimes the hot water tap just isn't working here, so I have to be like, I'm so sorry, fill in the blank, name of the client. I try to put my hands on the table heater if I can. Sometimes I'll warm up my hot stones so I can warm my hands up that way if I can help it, right? Hand washing protocol, I have that in this ebook. If you're at an event and you can't wash your hands, make sure and use hand sanitizer. Clean hands, short nails, or no rings, and clean clothes and no stink, and kept hair, all those things. So now moving on to sanitation, we start with hand washing, which was such an amazing leap, quantum leap in patient mortality in hospitals when we figured out that hand washing was important. Who'd have thunk it, right? Now it's like, even like little children know that you spread germs through dirty hands. And, even 150 years ago. People didn't know that. So amazing. So I have a list here in my ebook, hand washing protocol, but I'm sure you were trained in massage school. So you make sure the water is a comfortable temperature, get your hands all the way up to your forearms, your elbows. I wash all the way up to here because I use my elbows when I'm treating people. So wash all the way up or get it wet all the way up, get the soap, get it all the way up and swish it around for a really, really long time. Happy birthday to me. I think 3 times is what you're supposed to do. And if you have nails, get a nail brush, get in there and get a good soapy lather. 20 seconds, it says. Rinse your fingertips and elbows, making sure all the soap is gone. Rinse, rinse, rinse thoroughly, because that's where the germs get washed off, is when you're rinsing. Okay, so diving deeper into sanitation beyond using the proper cleaner when you're cleaning your room, making sure that the linens are changed, making sure that the table and the bolsters are sanitized. Beyond all of that sanitation, we need to talk about universal precautions. Universal precautions when it comes to the healthcare industry is for preventing the transmission of serious communicable diseases by assuming that all body fluids are potentially infectious. So this includes blood, saliva, mucus, urine, feces, semen, vaginal secretions, and vomit. Any of those body fluids that get on your linens need to be put into a protective bag, separated from everything else, so they don't contaminate the rest of the laundry, and they need to be washed in 1 part bleach to 10 parts water. Okay. And then, so that's the EPA protocol. So keep them separate, wash them in bleach, dry them in heat. All of your linens need to be washed with soap and dried in heat. It doesn't say specifically that they have to be washed in hot water, but that's a choice that makes sense in your options for the MBLEx, so make sure and get that. The biggest concerns for massage therapists, aside from bloodborne diseases like HPV or hepatitis, is MRSA, which is methicillin-resistant Staphylococcus aureus. It's a drug-resistant bacteria, and it can come out of boils or other infected areas. It's really important that if your client has made it clear that they have some kind of boil or a seeping infected wound, that you just don't treat them at all anywhere on their body, because you can potentially spread it. It's an absolute contraindication. If you're working on someone and then you stumble onto a boil that they might have and they just weren't aware of it, then make sure that the linens get washed as though there's a chance that it might be MRSA, and use those universal precautions, 1 part bleach to 10 parts water. Oh, something that I wanted to talk about, something that I almost forgot, was how to store the linens, which I don't know why I don't have that in here. Do I have it? Be sure to get those used linens in a closed container or bag and wash them in hot soapy water. So your linens need to be stored in a closed container. I have some laundry bags that I use. So I have laundry bags that I use so that I'm able to close them up, so there's not a chance that the germs can get out that way. And I keep them stored away from the massage table. Separate room is preferred, but if you don't have a separate room to keep them in, just make sure that they're kept away from the client, so there's no chance of any kind of contamination to your client. The first line of defense when it comes to keeping your client safe is getting that full health history, creating a health history questionnaire that covers all of your basic, most important contraindications, checking those off, and asking open-ended questions about medications that they're on, about the conditions that they might have listed in that health history, finding out exactly what you need to know, how to accommodate that client, or whether or not you need to refer them to their physician for evaluation before they are able to get a massage from you. So that's the first line of defense, and establish open lines of communication so that they're able to feel safe telling you whether or not the pressure that you're using is right, or they feel safe telling you if there's any changes going on in their body. Keep them safe. Okay. So, let's see. Referring to therapist self-care, which isn't really discussed enough, I think. Proper body mechanics are really important. Making sure that you stack the joints when you're working on your clients. So no bending, no like weird bends on the shoulder when you're working on them so that things get thrown off. So make sure that, those joints are stacked, those joints are stable. Make sure you use your body weight instead of your muscle strength to apply pressure to avoid injury. So the 4 principles of body mechanics that I have listed in this ebook. Weight transfer allows the massage therapist to shift body weight by shifting the center of gravity and adjusting pressure on the client. Stacking the joints allows the pressure exerted by the massage therapist to travel straight and effortlessly into the client's body as the therapist's center of gravity moves forward. Keeping the back straight, don't bend at the core, right? You engage the core, but you don't bend. And perpendicularity refers to the ideal positioning of the therapist's bodies and hands relative to the client during manual techniques. The therapist's body and arms should be placed at a 90-degree angle to the client's body while being treated. This alignment allows the therapist to use body weight rather than muscular force, making pressure more consistent and less tiresome for the therapist. Yay! Avoid using your thumbs as the primary source of pressure. If you do, make sure that they're tucked in really well and not hyperextended. Keep your wrist in a neutral position. What are the two main stances for massage therapy? You might be asked this on the MBLEx bow and arrow stance. That is where you are, you've got one leg in front of the other and you're going sideways. And then we've got the horse riding stance, which is perpendicular to the table. Okay? So sideways, and perpendicular. Those are the 2 ones. Bow and arrow and horse riding stance. So imagine bow and arrow, that's you being, and then horse riding. Okay, and avoid raising your shoulders when you're working on your clients. Don't be like this. Keep your shoulders down. So if you get a MBLEx question, it should be about keeping your shoulders down, your back relaxed. Okay, use your core, not your back. Vary your techniques up. Do all kinds of different stuff. Sometimes use your hands. Sometimes use your elbows. Go back and forth. So slow down and pay attention to how you're using your body so that you can be safe. What is considered full-time work for a massage therapist? 20 to 25 hours a week. Which, like, you think you're making so much money when you sign up to be a massage therapist, because if they're working for a business, they might be making $50 an hour. But if you're only able to work 20 to 25 hours a week, that still ends up being kind of the same as being just over a minimum wage worker. So keep that in mind. That's why I'm self-employed, so that I make that much more money, and then I can work 20 hours a week and still have a decent income. The reason that I don't like to do more than 4 massages a day is because I feel, sometimes my shoulders ache, but I feel emotionally drained after working on 4 people a day. So keep that in mind, that it's not all about the body. Massage therapists have experienced burnout more from the emotional aspect than from the physical. So keep that in mind. But just real quick about personal protective equipment for yourself. There are different kinds of masks. There are gloves that you can use. I keep some gloves around for when I'm working on somebody that needs a massage, but they have athlete's foot, stuff like that. So yeah, I use those. Or if I have an injury on my hand then I'll use gloves for that to keep my injury safe and also just for protective covering. Okay, so draping. Draping was the last thing that I wanted to talk about today when it comes to guidelines for professional practice. There are different standards for different states, but the general consensus is that what needs to be covered is the breasts for any gender, and your male clients may be like, why do I have to cover up my nipples? I don't have boobs. I go around without a shirt all the time. And I'm like, no, I just have to. It's just what I have to do. We have to. And I don't actually say it out loud. At first, when I first started practicing, I'd be like, you have to cover your nipples. But I don't actually say anything about it anymore. I just discreetly, quietly, without saying anything, I just kind of like gently cover their nipples up. When they're like, let it all hang out. But the gluteal cleft always has to be covered. The perineum, that's the area between the gluteal cleft and the genitals, and the actual genitals always, always, always have to be covered. And so there are different kinds of massages that will use different amounts of draping. So there's like lomi lomi that just has the genital area, gluteal cleft, and just over the nipples covered. That this needs to be adjusted according to your client's modesty preferences as well. Some of your clients will not want to undress. Some of your clients will keep their underwear on. So just adjust according to that. There are different kinds of folds that you can do, but those aren't such a big deal for the MBLEx. The main thing is to remember that the main areas that need to be covered: gluteal cleft, perineum, genitals, and breasts. And only uncover the body part being massaged and then recover it when you move on. Don't reach under the drape ever. That's very important for the MBLEx. Proper tucking of the sheet in key areas keeps it in place. When you want to do an abdominal massage with your client's informed consent, there's a special technique for pulling a small piece of fabric or a sheet or a pillowcase over the breasts to keep them covered, and then you can carefully fold down the sheet so that you can access the abdomen. So if you need to do an abdominal massage, do not reach under the sheet. You can do it over the sheet, or you can cover the breasts, uncover everything, and use the lotions and so on. So that's it that I wanted to talk about today. Now you're going to be able to find this PDF ebook in the description below this video. There will be one link that will take you to all the stuff, and I will have the guidelines for professional practice ebook linked in there. For right now, it's going to be free. So that might change if you get on this video in a few months. I might have changed that. I might start charging for it. I might make it a bigger deal and start charging for it. I don't know. But for right now, it's going to be free. So go check that out. And I'm really excited because my plan is that the next video is going to be part of a series on pathology. And I want to turn it into a course that you can access, complete with an ebook that goes along with it and worksheets to help you to remember these pathologies for the MBLEx. So I'm really excited about this project that I'm kicking off after this. So with that, make sure to subscribe and like the video if you loved it. And I will see you when we're talking about pathology next time. Toodaloo.